This short video will talk about 6 programs to prevent child mental health problems. These programs are aimed at families living with life challenges. We take a broad approach to life challenges. When we say life challenges, we mean many of the things that families can experience when they're going through tough times, like not having enough social support, money, job or housing problems, disability or physical or mental health challenges, struggling to keep down alcohol or drug use, relationship issues including family violence, and parenting challenges including child abuse. COVID has been particularly hard for many families. These 6 programs that we're going to talk about are aimed at supporting families living with life challenges to prevent later mental health concerns for their kids, so that their kids' mental health stays in the healthy and coping end of the child mental health spectrum. There is good evidence that these 6 programs work, which means that they have been shown to stop or prevent the effects of life challenges on kids' mental health in other settings. A group of research and clinical experts have identified these 6 programs as being a priority for children and families living with life challenges across Australia. And today we're interested in which programs, if any, you think are the most important for kids and families with life challenges in Wyndham. These are the 6 programs we're going to talk about in more detail. Parenting programs, school-based programs, psychological therapies, community programs, nurse home visiting programs, and economic and social service programs. We'll talk about what each program is and the research evidence for how well it works. As you listen to the information about each program, think about if the program is important for families in Wyndham. As we go along, you might like to use a pen or paper to write down any thoughts or questions you have about each program. The first programs are parenting programs. Parenting programs are designed to help parents and carers to develop skills, strategies, and confidence to parent their children positively. Parenting programs focus on creating a safe and positive environment for parents to learn skills to support them to cope under the pressure of family life. Triple P is an example of a parenting program that has good evidence in Australia. Parenting programs are offered to families with kids aged from birth to 16 years old, and also to educators of these kids. Parenting programs are offered to kids and parents who are coping well as parents of children who might have challenging behaviour or are from complex family situations. Parenting programs are delivered by a number of professionals, including family support workers, clinicians, nurses, psychologists. These programs can be delivered face-to-face, on the phone or online. They can be delivered for individual families or as well in groups. Parenting programs are usually offered in the family home, at the community centre or the health centre, and they range from being one-off sessions to 10 one-hour sessions each. Parenting programs can be free, but sometimes they can cost approximately $80 per parent. And these programs have been shown to improve social, emotional and behavioural outcomes for children, improve positive parenting, and reduce negative parenting and kids being placed outside of the care of their parents. The quality of evidence is based on the research studies that have been done about parenting programs, and there's a very high quality of evidence, which means that we can be very certain that parenting programs improve child outcomes and parenting. Parenting programs are also good value for money, and they do exist in Australia. The second programs are school-based programs. And there's lots of school-based programs, but today we're just going to focus on school-based anti-bullying programs. These programs are aimed at building children's self-awareness, relationship skills, responsible decision-making, and ways to respond to bullying. They can be given to all students in a school or all students in a whole year level. And these programs are usually delivered at school face-to-face or online. And school-based anti-bullying programs can be delivered by multiple trained professionals, including public health professionals, teachers and psychologists. They range from having 3 weekly 30-minute sessions to other programs that just have 1 session per month. The cost to the family is free for their kids to be part of these programs, and school-based anti-bullying programs have been shown to reduce the number of children being bullied and also the number of children bullying others. The quality of evidence for these programs is based on research studies that have been done about school-based anti-bullying programs. And there's a high quality of evidence, so 4 out of 5 stars, which means that we can be pretty certain that school-based anti-bullying programs stop kids from being bullied and bullying others. We don't know if they're value for money, but we do know that they exist in Australia. The third program we'll talk about are psychological therapies. Psychological therapies are talk therapy, including emotional education and problem solving. Some therapies with good evidence that you might have heard of are cognitive behavioural therapy, CBT, and interpersonal therapy, IBT. These therapies are aimed at parents with mental illness and their children aged from birth to 4 years old. Psychological therapies are delivered by trained professionals, including nurses and psychologists. These can be delivered in multiple ways, so face-to-face or online, in a family home or at the clinic. Psychological therapies can be done for individuals or groups, and they usually range from 2 to 33 sessions for 1 hour per session. Psychological therapies can be free to the family, but that also depends on if the family is eligible for government support, like having a healthcare card. Psychological therapies have been shown to improve a positive interaction between a mother and their child or children, improve child mental health, and also reduce poor mental health symptoms for children. And we know that these therapies work best when a mother and a child do the therapy together. The quality of evidence is based on the research studies that have been done about psychological therapies, and there's a medium quality of evidence, so 3 out of 5 stars, which means that we can be pretty certain that psychological therapies improve the mother-child interaction and child mental health. We don't know if they're value for money, but we do know that they exist in Australia. The fourth programs are community-wide programs. Community-wide programs aim to build a sense of community connection, care, and support for families. They take a whole-of-system approach, working with the whole community. And you might have heard of this called a place-based approach. Community-wide programs are adapted to local needs and use existing community assets and resources, working in partnership with health, education, social services, and community organisations. They can include things like outreach and home visits, support to parents and families, and support for good quality play, learning, and childcare facilities. Community-wide programs involve all members of a community and are aimed at supporting families with children aged from birth to 4 years old, and sometimes up to 10 years old. Some of these programs specifically target children who are living with life challenges, for example, low income or at risk of being in contact with child protection. Community-wide programs are delivered in community settings or sometimes in a family home, and they involve having an outreach worker or team who's responsible for coordinating the whole program. It varies across programs, but these programs can take 4 to 10 years to do in full. There's no cost to a family to be part of the programs, and these programs have been shown to improve positive parenting, improve children's positive social behaviour, and reduce negative parenting and kids being placed outside of the care of their parents. The quality of evidence is based on research studies that have been done about community-wide programs, and there's a low to medium quality of evidence, so 2 to 3 stars out of 5, which means that we actually can't be very certain that these community-wide programs improve parenting and child positive social behaviour. We do know that they're good value for money, but we don't know if they exist in Australia for kids in that 0 to 8 years range. The fifth program is nurse home visiting. Nurse home visiting is when a trained nurse visits families at their home after the birth of a child to support a positive home environment, positive interactions between parents and their kids, to teach parents coping and problem-solving skills, and to link families to any support services they might need. Nurse home visiting programs are for families with kids from birth until 2 years old, and they can sometimes begin before birth during pregnancy. Some programs are for all families, and other programs are targeted specifically at families living with life challenges, for example, mothers who might have low incomes. Nurse home visiting programs are where a maternal and child health nurse visits a family at their home, or this can also be done at the community centre. Nurse home visiting programs happen face-to-face and are mainly done for individual families, but they can also be done in a group. Nurse home visiting programs usually offer 18 to 34 sessions or visits to family homes, depending on what the family want and need. There's no cost to the family to receive a nurse home visiting program, and these nurse home visiting programs have been shown to improve positive parenting and a positive home environment. And some studies have shown that nurse home visiting programs reduces negative parenting, but other studies haven't shown that impact. The quality of evidence is based on the research studies that have been done about nurse home visiting programs, and there's a medium to high quality of evidence, so 4 to 5 stars out of 5, which means that we can be pretty certain that nurse home visiting programs improve parenting and the home environment. We don't know if they're good value for money, but we do know that they exist in Australia. The final program are economic and social service programs. Economic and social service programs involve linking families with low income to financial, employment and housing assistance. They're part of a broad social protection system. Economic and social service programs are aimed at low income families, and they can be either for individuals within the family, so a parent or a child, or they can be for the whole family. And these economic and social service programs are delivered by the government. There's no cost for the family to be part of an economic or social service program, but there are no impacts or changes in child mental health, in parenting, or in the home environment for families in these programs. The quality of evidence is based on research studies that have been done about economic and social service programs, and there's a medium quality of evidence, so 3 stars out of 5, which means that we can be somewhat certain that economic and social service programs do not impact on child mental health, parenting, and the home environment. We don't know if these programs are good for money, but they do exist in Australia. So these are the 6 programs we've just heard about. The next step is for us to talk about which of these 6 programs, if any, you think are important for families living with life challenges in Wyndham.